screen so we can check on that. And then we'll get started. Got it. So share that. And okay, Sheena, you should be able to see that now.
Yes, it's perfect. It's in slideshow mode, and so it looks real good.
Okay. All right. So as Sheena said, my name is Brad Talbot. I'm a certified Medicare counselor, one of 5 SHEBA program employees at the Idaho Department of Insurance. SHEBA is a statewide program that offers free, unbiased, meaning we don't get paid by anybody but the state, unbiased Medicare information for Idaho citizens. We have counselors, 150 volunteer counselors around the state. So wherever you are, we can get you personalized assistance. If you have questions after this, I'm sure you will, because this is ridiculously complicated. It says here, I'm going to try to simplify this for us all. That's my goal today. Before I jump into this presentation anymore, well, first of all, I want to tell you a little bit more about SHEBA. SHEBA is a really sexy name for a really mundane task, helping folks understand Medicare. But we are a part of the Department of Insurance, and we do presentations like this around the state. We also counsel people one-on-one when you have really specific personal questions about your Medicare. And we're available when you have problems with Medicare or a Medicare product like an Advantage plan or a drug plan. We take Medicare complaints at the department. For better or worse, all those complaints come directly to me. So you know who you're going to be talking to, at least initially. I will pass those along to various subject matter experts at the department and make sure you have somebody who can help you resolve those issues if they arise. I think more importantly, sometimes it's good to know what we don't do, and we don't sell insurance. We don't make commissions. We don't recommend anything. Our job is just to make sure you have the information you need to understand what choices you have, and you can make good decisions for yourself. Okay, with that, I want to let you know if you have questions, I'd love to take them as we go. So I'm sure Sheena will be monitoring the chat or the Q&A for us. So if you have questions, feel free to put those in or unmute yourselves if you can. That's fine with me. So here's my goal, is to make sure that if you're just starting Medicare, by the end of this, you'll have a good idea, a really good idea, hopefully, of which pieces, which options in Medicare are right for you and why. Okay, that's, you know, as good as we're going to get, and that's where I'm going to try to get us before we're done here. Now, before I jump into this, I want to acknowledge what Sheena said. I don't know if we have anybody on the call who's already on Medicare, but if you are already on Medicare, you already have Medicare Part D or Part C, then we are in the middle of the open enrollment period. Extremely important that you get in the habit of comparing your Part D or your Part C plans with what will be available next year, doing that every year. It will save you over time hundreds, if not thousands of dollars. The most common call we get in January and February at SHEBA is from people who have gone to the pharmacy or their doctor for the first time that year, and they're told they're no longer in network or their prescriptions are no longer covered on their drug plan. And so they're going to pay out of pocket. And that can be, as you all are probably aware, very, very expensive. And at that point, there's really not much we can do about it. So fall open enrollment, this is a time when you can make changes. We are glad to help you with that, as we'll talk about more at SHEBA. So Getting started, we're going to assume that from here on in, we're going to talk about starting Medicare and what you need to know. As it says, timing is important. Two reasons you're eligible for Medicare. One is you're turning 65, and two, you've been on Social Security disability income for 24 months. Either way, you get a 7-month enrollment period, initial enrollment period, in which you can enroll anytime in one of those 7 months. It begins 3 months prior to your 65th birthday or 3 months prior to your 25th month of disability, and lasts for 3 months after those months. Beginning next year, and let's start there, assuming that nobody is going to start Medicare in November or December. If you are, we can talk about that. But assuming you all are starting next year, it doesn't matter which month you enroll in, your coverage will begin the first of the, well, it does matter. So if you enroll in one of the first 3 months of your initial enrollment period, your coverage will begin on the first day of your birth month or the first day of the month that your disability began. If you enroll in any of the next 4 months, your coverage begins the first of the following month. Okay, that sounded really complicated. I hope you got that. Feel free to make me back up and come back to it. Okay, if you delay enrolling and you have a gap in coverage, there are penalties that get tacked onto your premiums, your Part B premium and your Part D premium, when you have a coverage gap. If you have questions about that, I'll probably gloss over it. Hopefully we don't run into that because we're going to enroll on time, but you can ask me if you have a question about that. If you're not going to retire from work when you turn 65, if you're going to continue to work and you're going to continue to be covered through your employer, so your employer has at least 20 employees, you're actively working, not semi-retired or something like that, and you're getting insurance through your employer, then most people in that situation delay enrolling in at least Part B. Most people enroll in Part A because it's already paid for. You don't have a monthly premium, so it costs nothing. It provides a little bit of secondary insurance, which is not a bad thing. Part B, however, is going to cost you $165 a month, and it's really not worth $165 a month. So most people delay enrolling in Part B and everything else until they retire. Once you're ready to retire, you can enroll in Part B and everything else a couple of months ahead of your retirement or up to 8 months after. Okay. I get ahead of these slides a little bit, so may skip through a bit. But here's an illustration of this initial enrollment period. 3 months before, you can begin enrolling up to 3 months ahead of your 65th birthday or your start month, and up to 3 months after. Now, it says down here there are delays associated with enrolling in one of these 3 months. That will not be true beginning next year. So just ignore that unless you're enrolling this year, and then we can talk about it. There are other enrollment periods. I've already talked about the two that are important for our purposes here. Open enrollment from October 15th to December 7th, and initial enrollment, which is when you get started. There are special enrollment periods, those life-changing event type enrollment periods that are available. If you need to know about one of those, you can ask now, or you can call me later and we can talk about your individual situation. All right, so I promised that I was going to simplify this for us, and here's how I'm going to do it. There are only two options for you to choose from when you're starting Medicare. The first is often called traditional or original Medicare. And that's what you see kind of outlined in blue here, Part A and B, and Part A and B have some choices called Medigap or Medicare supplements, and prescription drug plans or Part D. So this is choice one. About 65% of people when they start choose choice one. Choice two is called Part C or Medicare Advantage plans. This is a Medicare replacement, okay? We'll talk about why that's important terminology down the road, but these are the managed care HMOs and PPOs that you see advertised incessantly. If you're already getting a bunch of marketing material in the mail, or they're calling you on the phone telling you you may be eligible for certain benefits, extra benefits, well, ignore them. I'm going to tell you right now, you are eligible. So you don't need to call to find out. But this is what they're advertising, okay? Most of those advertisements are come-ons to give them an opportunity to gather your data, not give you information. And then they can sell your data to insurance companies so they can market directly to you. So by the time we're done here, hopefully you'll not be tempted by any of those come-ons and you can just ignore them. Okay, that said, we're going to start digging into traditional Medicare. That's a good place to start, parts A and B. That's where everybody's going to start to begin with. So let's talk about traditional Medicare. Part A, we call it traditional or original because this is what they created in 1965 when Medicare started, just a few years after Social Security. Part A was first, and initially all we had was inpatient hospital coverage. Okay, that's the important phrase here is inpatient. Part A pays, but only if you've been admitted to the hospital, okay? Meaning your doctor has to sign some kind of papers that say, I'm admitting you, you're an inpatient in the hospital. That's as much detail as I know about the process, but that has to happen before Part A pays anything at all. If you're an inpatient in the hospital and you don't have Part A, then your services won't be covered by Medicare. All right, now, if you're taking notes, and I hope you are, first note I want you to, a list I want you to start keeping track of is your out-of-pocket risks with each of the pieces that we're going to talk about, okay? Because this is how you're going to start to make your decision, your choice between one or two. All right, so Part A, for most of you, I assume you've worked 10 years or more. And if you have, you've already paid for Part A. So there's no monthly premium, no cost to it. There is, however, a deductible, and this is your first out-of-pocket risk. So listing under Part A, out-of-pocket risks, you'll put $1,500, or actually next year it'll be $1,600 hospital deductible. Part A pays 100% of the first 60 days of a hospital stay, an inpatient hospital stay, after you pay the first $1,600. Okay, now most of us are familiar with deductibles by now, I hope, and usually those are our annual deductibles. You pay them once and then the insurance pays. The Part A deductible is per occurrence. So it's not a $1,600 per year deductible. It's a $1,600 every time you get admitted to the hospital deductible. That can start adding up if you have a really bad year, obviously. So this is the first big out-of-pocket risk that we want to consider covering down the road. Okay? Hearing nothing at all, we'll proceed. Okay, so if Part A is inpatient coverage, it just makes sense that Part B is going to be outpatient coverage. Now, outpatient can be the emergency room. It can be the ICU in the hospital. You can have outpatient surgery, which most of them are these days, and your doctor's office, urgent care clinics, your specialists, all of that is going to be outpatient. So Part B, in fact, is going to cover most of your healthcare costs once you're enrolled. Okay. Now, Part B pays differently than Part A does. Part B, for almost all services, there are a few exceptions, but for virtually all, Part B pays 80%, which is pretty good. Maybe back up a little bit and say, first, you're going to pay a monthly premium for Part B next year of $165 a month. There are very, very few ways out of that monthly premium. So I'm going to assume that all of us here are going to end up paying that. We can talk about the few exceptions if any of you are interested. And we will talk about this before the end. But for right now, we're going to pay the $165 monthly premium for Part B. And then Part B is going to pay 80% when you go to your doctor's office, the hospital emergency room, etc. That leaves you with 20% to pay yourself, which is pretty standard, not bad insurance at all by American standards. However, the difference here from what you're used to is there's no cap on how high that 20% can go. This is where you start to hear about people running into medical bankruptcies. If your bill is $100, you're going to pay 20. If it's 100,000, you're going to pay 20,000, and it just keeps going up from there. So that's the second out-of-pocket risk that we want to make sure we cover in some way down the road. Yeah, Sheena?
This is Sheena. Quick question. So you have the $165 premium per month and the 20% of whatever the costs are for the services. But the real kicker here is that there's no cap. So there literally could be $100,000 and 20% of that belongs to me to pay.
That's correct. If your bill is $1 million, your share is $200,000.
Gotcha.
Okay, so definitely this is a much bigger second out-of-pocket risk, right? The premium we're going to pay, so that's a known cost, not a risk. But the 20%, that is an out-of-pocket risk. You won't pay it if you don't use services, but you will pay it if you go to the doctor or hospital. All right. Part B covers those outpatient services and some other things that are listed here. So, it is more complicated, but unless we're already planning to have some of those services and I'd be glad to answer those kind of questions. But for our purposes, just enrolling in Medicare for the first time, that's what we need to know. Any other questions so far, Sheena?
No, I think we're looking good.
Okay. Let's see, I think I pretty much already covered this, costs and risks of Part A. Some additional risks with Part A are, I said that Part A pays 100% for days 1 through 60. If you have a hospital stay that lasts longer, you're going to start to pay share of the costs, $389 a day for the next 30 days. And $778 for the next 60 days. And then after that, you pay all the costs. So this is another out-of-pocket risk that Medicare leaves on our plates, okay? And we'll want to try to mitigate that if we can. We talked about taking Part A or not Part A, and if you're going to continue to work. So won't touch on that. If you're someone who has a health savings account, you may want to delay Part A as well, or stop contributing to the HSA prior to enrolling, because once you're Medicare eligible, the HSA contributions are no longer tax exempt, and you'll get a really nasty tax surprise when you do your taxes the following year. Need to know more about that piece, you can talk to your CPA, not me. I don't really know much more about those HSAs than that. Okay, and we talked about Part B quite a bit. It says the premium's $170. It actually goes down $5 next year. Part B also has forgot to mention, a deductible. It's only $233 this year. It's going to be $226 next year. So it's very small. Why I usually forget it until later. But there is an annual deductible associated with Part B. Okay. And again, this is annual, not per occurrence like the Part A deductible. And if you're going to be employed, and insured through your employer, you're probably going to want to delay Part B once again. If you're not insured through an employer, and this means, folks have retiree plans for their employer, those don't count. They don't mitigate or eliminate the premium penalty if you don't enroll. If you have COBRA, that also does not eliminate the premium penalty if you don't enroll in Part B. Only active employment and insurance through active employment will do that. Okay, so we've covered parts A and B. That's really what you need to know when you're getting started. So we're going to start talking about the options that are available under Original Medicare here. Do we have any questions before I jump into that, Sheena?
No, I think we're looking good.
Okay. All right. So obviously we've talked about the two big out-of-pocket risks with Part A and B, the Part A deductible and the Part B coinsurance, the 20%. The third big expense that they leave for you is prescription drug costs. Part A and B don't cover them. So if you stay with Original Medicare, you're going to need a Part D plan, a prescription drug plan, to cover your prescriptions. So, and then there's also the option to have a Medicare supplement, or also called a Medigap plan. Okay, a Medigap plan is what we're going to talk about next. Okay, most of us, I think most of you, unless you've done some Medicare reading, you haven't heard of these. They don't act like any other insurance that I've ever been familiar with. So we're going to start there. I remember we're calling these, some people use the word supplement in Medicare to mean just about anything, so I try to avoid it. Supplements are also called Medigaps, and Medigaps supplement parts A and B. Really, what you need to understand about these Medigap plans is they're really very simple. If Medicare Part A or B pay their share of a medical bill, then your Medigap plan is obligated to pay its share of the balance. So the way that would work is if you go to the hospital and you run up $1,000 bill, assuming it's outpatient, Part B is going to pay 80%. Instead of coming to you, the 20% bill goes to your Medigap plan, and they pay most, if not all of it, for you. And if there's anything left over at that point, that would come to you. So if Medicare pays, the Medigap plan pays its share. If Medicare doesn't pay, the Medigap plan pays nothing. That's it. That's all there is really to know about these things. They're very, very simple. Okay, now there are different Medigap plans. It says here, standardized plans A through N, just to make it really interesting. Clever names that they come up with. However, we're not going to talk about all, how many is that, 13 plans? We're going to talk about 2. And I'll tell you why. So on this chart, you can see that there we have plans A through N, and C and F are isolated over here. And on the left of this chart are the benefits that Medicare A and B don't cover, are the big ones, okay? And you can see that in this side of the chart, plan G is the most comprehensive plan. It covers everything except that $230 Part B deductible, okay? So you'd pay that once a year, and then you would be covered 100%. You wouldn't see a doctor or hospital bill for the rest of the year. All right. Now this is the most comprehensive plan available to anybody who wasn't 65 prior to 2020. If you're older than that, if you're 67 or older, you can actually get Plan F. The only difference between the two is that Plan F pays that deductible, the Part B deductible. Plan G does not. Okay. So one of the first advantages, one reason you might choose to stay with traditional Medicare and get a Medigap plan is Obviously, having something that pays 100% or very near 100% of your medical bills makes it really easy to plan for your medical expenses. You pay the monthly premium, and you can rely on your insurance to pay the rest of your medical costs. So ease of planning, that's the first big advantage of this versus our other option that we're going to talk about later. All right. So you can get, now, if we're keeping track, and you should be, of costs, you can get Plan G right now for as little as $154 a month. So that's Plan G. It gives you, takes away that 20%. It pays the Part A deductible. It makes your out-of-pocket risk every year $233, or next year $226. Okay, so unlimited risk with Part A and B, $230 risk annually with Plan G on top of supplementing Parts A and B. Hope that makes sense. Let me know if not.
Well, one question is, if you, why would you ever choose anything that doesn't include the big excess potential for Part B? Are all of these plans about the same in costs generally?
Good question. Let's get to that. So just to compare, Plan F, again, the only difference between F and G is Plan F pays the $233 deductible. But Plan F, the least expensive one, I believe, is right at $199 a month. So it's about $45 a month more expensive. That's for about $500 a year in premiums that you would pay, instead of paying the $233 annual deductible. So Plan G actually saves you money because the premium costs are that much lower. Okay. Now, the rest of these plans, frankly, right now are kind of dinosaurs that none of the insurance companies want to sell. And I'll tell you why. You can see that A covers much less than G, B covers quite a bit less than G, D very similar to G, but not quite as much. And these excess charges are what a doctor who doesn't accept Medicare can charge you. Plan G will cover those, Plan D will not. Same with, the rest of the plans, some less coverage than Plan G. And the insurance companies are charging nearly the same amount for the rest of these plans as they are for Plan G. So it doesn't really make a lot of sense to talk about them very often. And frankly, I can't remember the last time I did.
Okay.
So maybe someday they will make another decision and lower those prices and start, a couple of years ago, we did talk about Plan N fairly frequently. And I haven't looked at it for a while. So we're going to look at a rate chart here in just a moment, and we'll see if it's worth talking about Plan N.
Okay.
The only difference between, go ahead, Sheena, you had a question?
Okay, yeah, I understand. Now, what on Plan, explain what excess charges means, because I think that's the key to it, right? So excess defined by whom? Because the risk is really for the 80/20, the 20 piece that we would have to pay. But that does that include is that what excess means, the part of
No.
the 20, or is excess some other definition?
Yeah, excess charges are something else. So Plan G covers excess charges. It covers the 20%. It covers everything else. If you chose a plan like Plan N that doesn't cover excess charges, and you saw a doctor, you went to a doctor who doesn't accept Medicare assignment, he or she can charge as much as 15% more than Medicare will pay. Plan G would pay that 15%. If you have Plan N, you would pay the 15%. Okay. Now it's an easy, if Plan N is interesting to you, it's an easy cost to avoid. You just have to ask every doctor you see, do you charge excess charges or not? If they say yes, you'd probably want to avoid them, especially if you're seeing them for a very expensive procedure, right?
I see.
Makes sense?
I see. So it isn't that I go in and I'm an outpatient, and the outpatient total expenses is $100,000. Now I'm left with coming up with the 20,000. That's not what we're talking about. What we're talking about is the original 100,000, whether Medicare would have agreed with that amount, or would Medicare have only agreed to 80K of that 100,000, and now I'm left with the 20.
Right. You can be left with, as if you've got one of these plans. So we'll stick with Plan N.
Okay.
Plan N does pay the Part B coinsurance, the 20%. Okay.
Okay.
Doesn't pay the 15% excess charges though.
Okay.
So if you go to a doctor who accepts Medicare assignment and you get $100,000 bill, Part B is going to pay the 20,000 that Medicare doesn't pay. If you have Plan N and you go to a doctor who doesn't accept Medicare assignment, he can charge you $115,000, and Medicare, your Plan N would not pay that extra 15. It would pay the 20,000. Medicare Part B would pay 80. Your Plan N would pay the 20 that's left over, but there's that extra 15 that he's allowed to charge that you would pay. Plan G covers that 15. Plan N does not.
I see. Okay. So it really is by the definition of whether that particular doctor or that particular procedure, or whatever it is costs more, you will be charged more than Medicare would have paid.
Correct.
Gotcha. Okay.
Yep. Absolutely. That's correct. All right. So let's take a look at a rate chart here. So I point out this website, doi.idaho.gov. This is where these rate charts live. The rates for Medigap plans are approved by the state of Idaho. So we keep an updated list of all the companies that sell Medigap plans here. You can see them all on the left. You can see the dates on which they last changed their prices. All here. There's interesting reason why they're all almost the same at this point. We changed the rules, and so they had to change their prices as a result, and that's why they're all the same right now. And you can see the current prices. So for Plan G, you can see that the least expensive plan is $154 a month. Okay, for Plan F, if you're eligible for Plan F, and I'm guessing there aren't many of you on the call that are, but if you're interested in Plan F and you're eligible, you can see that I don't think there's any below $100 or $200. So right around 212 bucks a month, $207 a month for Plan F. Again, the only difference is that $233 deductible. So it doesn't really make a lot of sense to pay $50 or $60 more a month for Plan F versus Plan G. Okay. Now there is one other, I did say I would look at Plan N. There used to be a Plan N that was $111. Oh, there is still. So State Farm has Plan N for $111. This is not a bad deal. The Plan N, you would have $20 copays at your doctor's offices, and you'd be at risk of those excess charges. But as we said, you can avoid those charges just by asking if they charge them and finding another doctor if they do. So you can save yourself versus Plan G about $400, almost $500 a year in premiums and go with Plan N. Okay. The other plan that I point out to everyone is this GHD. This is exactly the same coverage as Plan G, but it has a high deductible. So remember, Plan G, you just pay the Part B $200 plus annual deductible. Plan G, you pay more than $100, so $1,200 a year or less in premiums, but you get a $2,600 deductible. Okay, so is that actually worth it? Let's see how that works out. You're saving $1,200 a year in premiums. Your out-of-pocket risk now, instead of $233, is $2,600. All right, but you're saving $1,200. But it's not a true deductible because Part A and B are still paying their share before you meet the deductible. Okay, so how would that work? If you went to the doctor's office and ran up the $1,000 bill, Part B would still pay 80% before the bill goes to your Medigap plan. Now your $200, you would pay the leftover $200, but that would go towards the deductible. Okay, so now your deductible is only $2,400 for the rest of the year. You still have the 80% coverage. If you had an inpatient hospital stay, you would pay the $1,600 deductible when you're first admitted, but Part A would pay for the next 60 days, 100%. Okay, your $1,600 deductible would go towards the Part G high deductible. So now it's only $1,000 before you're covered 100% for the rest of the year. This is actually really good catastrophic expense protection. Okay. Now let's see why I say that. So you've got a $2,600 annual deductible, but you have all this coverage before you meet the deductible. If you go with the other option, I'm just going to jump across the way here for a moment. The Advantage plans all have out-of-pocket maximums that protect you from these out-of-pocket risks. The average out-of-pocket maximum next year, it will be about $6,000. So more than twice as much as the Plan G high deductible out-of-pocket risk. So for $46 a month, I think this is worth considering for a lot of folks. I don't know what kind of insurance you've got now, but most employer insurance plans have out-of-pocket maximums from $3,000 to $8,000. They have deductibles that are in that same range. So it's not much different than what you're probably used to. And it's a really good price. Now, one other reason that, well, the reason this is an important decision to make upfront, Medigap versus Advantage plan, is that you only have 6 months when you first enroll in Medicare in which you're guaranteed to be able to get a Medigap. During that time, you can buy any Medigap plan you want from any company. They can't ask you about your health, and they have to sell it to you at the published price that we just looked at. Okay. After that 6 months is over, they can ask about your health. And if they don't like what they hear, they can decline you. They can charge you a higher rate. They can eliminate coverage for certain conditions, or they can decline you outright. So it becomes, especially for those of you who have, chronic conditions already, or serious illnesses already. If you see a specialist 4 or 5 times a year, you really need to consider a Medigap very carefully. Okay, because you're not likely to be able to get one later when your condition worsens, if it does.
Okay.
Does that make sense, Sheena?
Yes, it does. One question about that is, so let's say I chose Plan N and now I don't feel as strongly about that, and maybe I want to change to Plan GHD, but I'm still in that 7-month window. Can I switch back and forth during that time?
Good question. Yeah. Yeah, and the answer is yes. You can change Medigap plans anytime you want. Okay, there's no enrollment period associated with them. So if you have a Medigap plan, you can decide to go to a different company, or you can buy a different plan from the same company, as long as the company is willing to sell you one. Inside your initial enrollment period, inside that first 6 months, they can't ask you about your health. Outside it, they will.
Okay,
So
gotcha.
now, the big change that Idaho made in the law last year was we created an annual enrollment period for the Medigaps. Now, it only applies to people who already have a Medigap. If you have a Medigap on your birthday and for 2 months after every year, you can make a change with no underwriting, no health questions being asked. And you can buy one from any company as long as it has equal coverage or less coverage. You can't go from a plan G to a plan F, but you can go from G to N. Okay.
Wow, okay.
So you
That-
get 2 months now to make a change, no questions asked, if you buy a Medigap plan to begin with.
Okay, okay. So once you're in the Medigap arena, the state of Idaho at least gives you an opportunity to change among those plans 2 months out of each year.
That correct. Yeah, that's right.
Without underwriting.
That
Okay.
yeah, exactly. The key.
Wow, that's awesome.
Right. Yeah, really good. Now, if you're joining Medicare due to disability, I really encourage you to think about a Medigap plan, because, well, again, the Advantage plans, you're going to spend something out of pocket every time you use services until you reach that out of pocket maximum of between $5,000 and $6,000, if not more. And the Medigap plan, you're going to pay a higher premium for, but it's going to cap your out of pocket risk at between $230 and $2,600, depending on the plan you select, right? The Medigap plans are going to cap your out of pocket risks at between $4,000 and $8,000 is the range that's available. So that's why Medigap can be really important for somebody who's already got serious conditions. Okay. Another reason to consider sticking with traditional Medicare and a Medigap plan is the flexibility it provides. With the federal healthcare plan, parts A and B, it's federal or national. So you can take it anywhere you want and see any doctor you want. And 94% of doctors in the US see Medicare patients. So if you needed to see a specialist in Salt Lake or Seattle or Boston or Boca Raton, for that matter, right? You can do that, no questions asked. Medicare never requires prior approvals. It doesn't make referrals. You can, if you feel the need to see a specialist somewhere or just another doctor, you can do that. As opposed to the Advantage plans, which are going to require you to use their network of doctors and hospitals. This again becomes really important. Some people think it's important for travel. I think that's less of an issue. All Medicare plans are going to cover you for emergencies when you're traveling. But if you're going to need to see a specialist out of state, if with the Advantage plans, the further you go from home, the harder it is to find network doctors and hospitals. And if you need really serious care, like the transplant center in Salt Lake, or you have to go someplace like Mayo Clinic or Cleveland Clinic or Stanford for specialized care, they won't even talk to you if you've got an Advantage plan. We've got a Medigap plan, Medicare A and B and Medigap, they'll roll out the red carpet. But not so with the Advantage plans. Does that make sense? Okay, hopefully so.
I think so.
Okay.
There is one question here.
Okay.
Here, Gypsy, you want to ask this question, or you want me to fumble through it?
I guess go ahead.
Okay, we'll go ahead. I'll give it a shot here. So this is about an Advantage plan. So when renewing Medicare Advantage plan, what is the best way to find out if your provider is still covered for the next year? So in for example, now you'd be looking for who's covered starting January 2023. Juicy has been calling around each of the providers that she used to ask if they, or to look at the website of her doctors currently, but gosh, is there an easier way instead of looking at each and every part of the plan?
Okay, so you were kind of cutting in and out, Sheena. Let me make sure I understand the question. Is there an easier way to make sure your doctors are in network if you're choosing an Advantage plan? Is that right?
If you have chosen one, yes. Uh-huh.
Yeah, good question. Virtually no. The answer, unfortunately, is
Okay.
not really. Um, and I'll just elaborate a little bit. Each company, each insurance company and each plan is required to publish a list of their network doctors and hospitals. Most of them make those available online. However, doctors come and go from these networks with a high rate of regularity, frankly, and they don't update their lists frequently, maybe once or twice a year. So the only way to really do this accurately and be certain is to call your doctors when you're considering a new plan. Hey, I'm looking at United Healthcare or Blue Cross of Idaho. Are you in network with either or both of those plans? That's really just about the only way to do it accurately. The doctor's billing offices, they're going to know who they're contracted with. You can call. I can't tell you how many referrals we get from Blue Cross or Select Health or any of the other companies. And they call and say, I called to ask them if my doc was in network, and they said, call Sheba.
Oh my goodness.
So, yeah, unfortunately, it's really the only accurate way to do it.
Okay, it's difficult. One other quick question. Well, so that sounds kind of scary. Okay, because what it feels like is that the earth is trembling underneath you all the time, but you don't really know whether it's a, it's a level 5 earthquake, or is it, I mean, it's just always changing. So that, and no real good way other than to just call your doctor's office and see if it's changing for you. So okay, one
Yeah,
other.
now the plans, if they're not going to notify you ahead of time. We get to talk to a lot of people whose doctors will notify them. Hey, I'm leaving, the Blue Cross of Idaho network. Just want to let you know. There's
Nice.
not much you can do at that point, usually, unless it's the open enrollment period, but generally they'll let you know.
Okay. And then just double checking, and I would agree that this is such a big difference. We really do need to make sure we get this one clear. Did you say that here in Idaho, and that's important because it's not true everywhere, I take it, by Idaho law now, if you have a Medigap plan, if you choose a Medigap plan initially, so every 2 months, every year for 2 months around your birthday, you can change from one Medigap carrier to another one without requiring underwriting. Is that right?
That's exactly what I said. Yes.
That is such a huge thing. That's, I mean, to me,
Yeah.
that's a big advantage that we have here in Idaho for that law. Are
Right.
there
So
other states that do that?
yeah, I think it's a really it is a big change, and it allows Medigap beneficiaries to actually shop around once a year and save some money. As it was, well, I can just tell you, my mom has had Plan F for 30 years, and she hasn't, she's made use of it, right? Never seen a doctor or hospital bill, so it's been great. But for 30 years, every year, there's been a slight increase, 5-7% or so every year. So the cost of that plan has gone from about $120 a month to over $300 a month. And she wasn't in a position because of her health to make a change. And now she is, so she can get a plan F if she wants for as little as $200 a month. She could get a plan G or a plan N if she chooses that as well. So it is a really big change.
Nice. Okay.
We talked about when you can buy a Medigap plan. I hope that's clear at this point. If there are more questions about Medigaps, let me know, but we're going to jump into the last option you have with traditional Medicare. Remember, original Medicare we're talking about still. We've talked about parts A and B and the supplements for part A and B. The final one is part D, or your prescription drug coverage. Okay. Obviously, part D covers prescription drug costs. It doesn't cover all the prescription drug costs, but it's what we've got. There is a monthly premium on all the plans. Next year, it ranges from a little over $5 to about $140 a month. I'll tell you right now, paying more doesn't necessarily get you more. It just depends on the medications you're currently taking. Most of the plans have a deductible, but none of the plans apply that deductible to generic drugs. So most of you probably won't pay that deductible. And most of the generic drugs are going to be covered 100% if you go to a preferred pharmacy. Okay. Now, important to understand that, if you took a list of all the medications that are available and divided it up into categories, painkillers and antibiotics and blah, 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 down the line, each company or each plan is required to cover a certain number of those drugs, but not all of them. So there are a lot of drugs that are not on any of the formularies, the lists of drugs that are covered. And the formularies vary from one company and one plan to another. And then there are preferred pharmacies, and there are network pharmacies, and there are out-of-network pharmacies. Obviously, you get a different price depending on where you go. So there are, I think next year there are 28 different drug plans in Idaho available. So there are a boatload of variables to consider when you're choosing a drug plan. There is a very easy way to do it. Do I have a slide on this? No, I don't. But Medicare.gov is the website you're going to want to get familiar with. And I'll just tell you up front, we're glad to do this for you, but this is the tool we would use if we did a drug plan comparison. Medicare.gov has a button on the front page, the home page, says Find Health and Drug Plans. Punch that sucker and it's going to ask you for your zip code and then a list of your medications with the dosages. Once you've completed that, it'll ask you a couple of more questions. And then it will spit out a list of all 28 drug plans from most effective based on your drug list to least effective. So you'll find that, and the number it's going to use to compare is the premium, monthly premium plus your drug copays. So what you would spend at the pharmacy. So it's a true out-of-pocket comparison. Okay, and you'll see that number, the premium plus your copays, that's the number that just keeps going up the further you go down the list. So, it's pretty rare that I go much further than number 3 for somebody. Every once in a while they want to make sure I'm showing them everything that's available, and that's fine. I'm glad to do that, but it's a really good tool that makes comparing these plans for your specific situation very easy. Give it a roll. If you feel like it, give me a call. I'm glad to do it for you. We can talk about exactly what it's saying if you don't understand it, which, frankly, I wouldn't have understood it 7 years ago when I started either. So no harm, no foul there. No judgment. You can get a Part D, and you should get a Part D when you first enroll in Parts A and B. If you don't, If you don't have other creditable insurance, then there is a premium penalty associated with Part D as well. So try to avoid enrolling late. And yep, you can enroll by calling the plan directly, which is kind of a pain in the butt. If you use Medicare.gov, there is an enroll button next to every plan on the list once you create your plan comparison. It takes about 10 minutes at the most to fill out the application. You get a confirmation number and you walk away. Okay. If you enroll in your initial enrollment period, it's going to take effect, the first of your birth month. If you're changing plans now during the open enrollment period, your coverage begins on January 1st. So not too complicated. That's the drug plans. Any questions about that, Sheena? Okay.
About that, no questions at this point.
Okay. All right. If you have some later, we can come back to Part D. So that's original Medicare. About 65% of people stick with original Medicare. And the predictability and the flexibility are the two main reasons. Also, the fact that there's underwriting if you wait very long, that's the other reason. So, who should be looking at those? Certainly the folks who already have serious conditions should be looking at original Medicare, at least considering it. I know those premiums may make it out of reach it does make it out of reach for a lot of folks, but it's something to consider. All right, your other option, we're up to option number 2 now. So we're halfway there. Option 2, as I said, is the Medicare Advantage plans. This is what you've seen advertised incessantly. You might ask yourself how they can afford to advertise so much. They make a boatload of money, frankly, is how they can do that. Medicare Advantage plans are very profitable. Sorry. So now remember I said that the Medigap plans are Medicare supplements. They supplement parts A and B. Advantage plans are Medicare replacements. Okay. You no longer have parts A and B. You will, if you have your Medicare coverage will now come from a private insurance company like Humana or Regents or Blue Cross of Idaho. So if you have a question about your insurance, you won't call Medicare, you will call your private insurance company. If you have a complaint or a dispute about the service, then you're going to call the private insurance company, not Medicare in general. All right. They have to cover everything that parts A and B cover, but they're allowed to do it in much different ways. For instance, the inpatient hospital coverage that the Advantage plans provide doesn't require an upfront deductible, that $1,600 deductible if you're admitted to the hospital. Instead, they divide it up into between 4 and 6 days, depending on the plan, and you'll pay between $275 and $400 a day for each of the first 4 to 6 days. So, if your stay is only 2 days, you actually do a little better. But if you stay the whole 5 days, you pay a little more than the $1,600 on an Advantage plan. So they're allowed to do things differently than Medicare A and B do. Almost all of them, not all of them, but almost all of them include prescription drug coverage, Part D. So some folks like that package deal benefit. And they can provide some things that Medicare doesn't, these extra benefits. The main ones are vision and dental coverage. Those are the ones that most people are concerned about. Also, throw in some gym membership discounts, a couple $100 worth of over-the-counter drugs you can use to pay for things like cough medicine and aspirin and things like that Part D won't cover. And there are others. And there are some really good, frankly, very good Advantage plans that cost nothing. So you've seen this advertised, I'm sure, a lot too. you may be eligible for a free Medicare Advantage plan with lots of extra benefits. You are eligible. So we'll just, again, bypass the advertising. I'll tell you right now, you're eligible as long as one is available in the county where you live. Next year, there are 5 counties in Idaho that won't have any Advantage plans. This year, there are 12, so it's actually expanding. But let's take a look at what they are. So these are probably what you're used to. If you've working for a living and you've got an insurance plan from your employer, or you've got Obamacare, an ACA plan, HMOs and PPOs. HMOs, meaning they're trying to control their costs. They claim they're trying to control their costs by managing your health care. I'm not sure I believe that, but they are trying to control costs. And the way they do that is by contracting with a subset of all the doctors and hospitals available in your area. And if you have an HMO, you are required to see those network doctors and hospitals. If you go out of the network, you don't have any coverage. Okay, so not very flexible, unlike traditional Medicare with a Medigap plan. PPOs are a little more flexible. They allow you to go out of network, but you'll pay a much larger share of the costs if you do, as much as 50% or more of the costs. So, but those are the 2 options in the Advantage plans. Now, just like insurance that you probably have now or had when you were working, pretty much every time you go to a doctor or hospital, there's going to be a copay. And if there are services provided like tests or something, you're going to pay a percentage or a fee for those tests, and your insurance will pay the balance. HMOs and PPOs are going to require you to get referrals to specialists and prior approvals for things like surgery or anything else your primary care doc doesn't provide. If you leave the county or your zip code, you're probably going to have to change Advantage plans because they don't travel well. If you leave the state, you definitely will have to change Advantage plans. And just like the drug plans, you need to compare your Advantage plan with what's coming in the new year every year during open enrollment. The Advantage plans and the drug plans both can change their premiums, the deductibles, your copays, and the list of drugs or services they cover every year. So it's really important to get in the habit, whether you've just got a drug plan or you've got a Medicare Advantage plan, of giving us a call. We're glad to do this for you, or use Medicare.gov to compare Advantage plans and drug plans in the fall. Okay. Now, as I said, the Advantage plans cap our out-of-pocket risks by providing an out-of-pocket maximum. And that ranges from about $4,000 and goes up to about $8,000, depending on the plan you select. Monthly premiums range from $0 to about $140. I think that's going to be true again next year. I know there are lots of 0 premium plans. I think 140 is about the most expensive, though. And so, as I just said, there's going to be copays. You're going to come out of pocket for just about everything until you reach that out-of-pocket maximum. So it can be a lot more difficult to budget for your health care unless you stay really healthy, than if you had a Medigap plan. Remember, Plan G, the most you're going to spend is $230 a year. With an Advantage plan, you're going to pay a copay or a co-insurance every time you go. Hospital's not going to tell you what they're going to charge you up front, and you're going to pay a percentage of a hospital bill with an Advantage plan in most cases. So there's no way to tell what that's going to be, right? You've got a cap, but you don't know how close to that cap the hospital stay is going to be. So that's one of the disadvantages of the Advantage plans. Now, they do include those things like vision and dental, and some of those benefits are pretty good, better than you would get if you just bought a separate vision and dental plan, actually. And some of them are not so good. So again, there's a list of all those benefits on Medicare.gov. So when you're comparing, it's one of the things you want to take a look at is the extra benefits. Other benefits can include things like travel to and from doctor's appointments for a certain amount of time, meals provided to your door after a hospital stay for a certain amount of time. What else have I seen? The over-the-counter benefits. And there are some others that don't add up to a whole lot, but those are the main ones. And certainly for no premium, for free, this is a really good deal, frankly. So, and that's why, more and more people, as time goes by, are choosing Advantage plans instead of traditional Medicare. Anything else we need to cover about Advantage plans? There are, I think, 45 different plans available next year. In Ada County, where I'm at, I think virtually all 45 are available. And then depending on where you're at, there may be as few as 2 or 3, or 0 if you're in one of those 5 counties that don't have any. So it may make sense to choose an Advantage plan in one of those counties that has very few options. And it may not. With so few options, they're going to be more expensive and they're going to have fewer benefits, frankly. And I'll also give you a warning that we've come up with since open enrollment started and we've seen the new plans. There are new plans available in certain counties, and there are 7 counties that have plans this year that didn't have plans last year. And although plans are available, not all the plans have any doctors in their networks in the counties where they're operating. So if you're in one of those counties that has very few options, especially important to make sure that your docs are in network before you sign up.
Wow.
All right. Questions about Advantage plans,
No, I don't. No, we don't have any.
All right. Well, then, here's where I say, I promised you I was simplifying this thing. We've talked about the 2 options, traditional Medicare with a Medigap or Advantage plans. The Advantage plans, obviously, if the Medigap premium is just out of reach, a 0 premium Advantage plan is a really good deal. If you've got serious health issues, you may want to bite the bullet and buy a Medigap plan, even if it's, stretching your budget a bit. The folks who have a really hard time, who I don't feel too bad for, but the folks who have a hard time deciding are the ones who can really afford a Medigap plan, but are healthy enough not to want to buy one, right? So you're actually in your golden years now, and you're going to have to go sleep on it or something and try to figure it out. For those who are really challenged financially or challenged health-wise, pretty obvious choices and generally. So before we end, I do want to point out there are some programs available for people who need help paying for all of this. No matter what you do, you're going to pay the $165 a month Part B premium. Okay, and there are actually 4 programs available that will pay the Part B premium for you. One is Medicaid, which isn't listed here, but also there are what's called Medicare savings programs. One of them pays the Part B premium and all your copays, deductibles, and coinsurance when you go to the doctor or hospital. So it's like having a Medigap Plan F. Okay, that throws in a free drug plan because it enrolls you in extra help. That buys you a drug plan and pays most of the cost of your prescriptions. So this can be an enormous lifesaver, frankly, for a lot of folks. To qualify, your income has to be below $1153. It's a little higher than that for next year. I don't have the exact numbers. and you can't have any more than $8,400 in the bank. And then there are two others that only pay the Part B premium and enroll you in extra help, which pays for prescriptions. These are available from the state of Idaho. You'd call the Department of Health and Welfare to find out if you qualify. If you don't, if your income is above about 1560, I would guess, then you probably won't qualify for a Medicare savings program, but you still could qualify for extra help, which would pay for your drug plan and cap your drug costs at $9 and change, no matter how expensive your prescription is. So you could have a $5,000 prescription and you would pay less than $10 for it if you have extra help. You apply for this through Social Security. If you're not qualified for one of these, they get it for you automatically. Excuse me, you would call Social Security to apply for extra help. You can always reach me. Well, you can mostly reach me at this number, Shiva's number, 800-247-4422. Here's Medicare's number as well, Social Security, and the Medicaid office at Health and Welfare, if any of you are interested. So Sheena, that is my show. And that's all you need to know to get started in Medicare. Hopefully I delivered on my promise and made it understandable. If not, I can hook you up with somebody else who would be glad to sit down with you and go over it all again. We're happy to do that. We know it's complicated and these are really important decisions. So that's what we do. If you want to see somebody in your area, we probably have a counselor available to sit down with you no matter where you are in Idaho. So thanks for having me. If you have other questions, Sheena.
Well, yeah, it is complicated, and it is. I think what you impressed upon us, is how important this decision is. So that was good. The big takeaway for me was one of the people that I had looked to help me. Well, she had just anecdotally said, you need to get yourself ready for Medicare, start working on it a year ahead of time, and make sure that you are clear on what you need to do long before it's time for you to do it. And then I found out, and by my doing that and talking to her, we found out that she had, even though 10 years ago, when she started Medicare, she had never looked at her Medicare Part D plan. She had never even looked at it. And I said, I think I'm supposed to tell you, you're supposed to check it every year, every single year. And she was, so you learn, even though the teacher learned from the student and vice versa. So it was very good to have you reiterate that for us.
Yeah, I can tell you, just a couple of years ago, I met with a couple in Gooding. They were retired state employees, so they just went with a Blue Cross Advantage plan because they'd always had Blue Cross from the state. And it had been about 14 years since they had enrolled in Medicare, and they had not compared their plans once. And we figured that they'd spent about $14,000 more than they would have had to if they had done the comparison every year.
Oh my goodness.
So yeah, it's important.
Okay, great. I just want to let everybody know that we did record this. Brad gave us permission to do that. And so if you want to go back through any parts of it or listen to it in its entirety, it'll be out on YouTube. YouTube.com, just go to YouTube like you would any other time. And then search for NKA Idaho. Once you put that in, all of the NKA recordings will be there, and that's where this one will be as well. Probably in about an hour and a half from now. So hopefully that'll get you out there real quick. If not, again, you can call me 208-861-5789. Okay, Brad, thank you so much. This has been helpful. It is complicated, but it's helpful to have you go through it for us. So any other questions for Brad, just let us know and we'll get those to him. Other
Okay,
than that,
Sheena, thanks for hosting. I appreciate it.
thank
And it was
you.
fun.
Thank you. Bye,
Okay.
everybody.
Bye-bye.
Appreciate it.